Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm here with Dr. Iman Abuzeid, the co-founder and CEO at Incredible Health. How are you today?
I'm doing well, Jared. Thank you so much for having me.
I'm excited to chat. I've followed your company for a while, and it's really exciting to be able to talk with you in a podcast setting. And I'd love if we could just kick things off for the audience, if you could tell them a little bit about yourself.
Sure. My name is Iman, and I'm the co-founder and CEO of Incredible Health. I guess by background, I'm an MD. I don't practice at all anymore, but I've been in healthcare technology for the last 10 years of my career.
You had to throw in the don't practice at all. Well, we were talking for the audience. So we were talking before in the intro, I was going to say doctor, right? And then you're like, okay, but just in the intro you can, but then after that, just don't say it. And there you go.
Yeah, but because I can't help with anyone's rashes and stuff like that right now, right?
I mean, I'm sure the knowledge base is still there for you to pull from when you need it.
Yeah.
Even if you're not practicing. Well, I'm excited to chat more. Can you dive into, we focus on three core things: the why, how, what of Incredible Health, and then there's a few things that you and I wanted to chat about today that we'll go into.
Sure, that sounds great.
Perfect. Well, I'd love to hear your breakdown of Incredible Health's why, how, and what.
Sure. So Incredible Health is the fastest growing career marketplace for healthcare workers in the US today. And what that means is hospitals and health systems use our software to hire nurses in permanent roles in 20 days or less. Normally takes 80 days or longer. We're already used in over 500 hospitals and health systems across the country, including academic medical centers like Johns Hopkins and Stanford and Cedars-Sinai, big health systems like HCA and Baylor Scott and White, lots of community hospitals too. And the end result of what our product does is nurse hiring in permanent roles that happens faster, and it's significant cost savings for hospitals and health systems too, because they don't have to spend as much on contract workers and overtime and other HR costs. So we save at least $2 million per facility per year. So that's the what of what we do. Happy to go into more detail in terms of like how we do it. But I did want to touch on the why. Our mission at Incredible Health is to help healthcare professionals live better lives and help them find and do their best work. And what we're doing together as a team, and as well as with the nurses and the hospitals we're working with, is we're building the category-defining, market-leading company in healthcare labor. And for me, it is personal. I believe that healthcare workers are some of the most overworked and underappreciated workers in the country. And if we can be the one product service company out there that's giving them a delightful experience, then we've won. I mean, that's ultimately what I want to achieve and what gets me up in the morning too.
And this is a space that I'm very familiar with. Like earlier in my career, I worked for a company, Medicus Healthcare Solutions, that was in the staffing space, and not specifically nurses, but pretty much every other specialty. And I always, even when I was there, we need a platform, we need a marketplace, just doing things the traditional way of all these. I mean, there's so many of these staffing agencies, and it's, as you said, the experience isn't necessarily great.
Yep.
Right. It's not really great for the facility. It's not great for the professional. And I guarantee you it's not helping burnout the way it was being done in the past. So yep. It's really great to see what you're building. And how strong that why is for you. I'd love if you could go into, I guess, more of the how things, sure. And maybe from both ends.
Yeah, absolutely.
Because it's essentially a two-sided marketplace, or are there more sides to it than that?
It's two-sided. Yeah, absolutely. So there's three unique things about our product that drives these results. The first is that the employers are applying to the talent instead of the other way around. As you can imagine, the nurses today absolutely love that, because they create a profile, they sit back and relax, they get interview requests from employers that are relevant, and the nurse gets to choose which interviews to accept or decline. So they have a lot more control over what's happening in their job search. The second thing that we do that's unique is our software and our automation pre-screens and pre-vets the talent. So we're only serving up very high quality talent to the employers. The employers love that because they don't have time to waste. I mean, the average nurse recruiter is trying to fill 100 or more jobs at any given time. And, using a traditional job board is just not good enough. I mean, all that does is give you lots of applicants. You still have to manually screen and do that. And so with some help with automation, we're doing the pre-vetting and pre-screening for them. And then the third piece, which is probably the most critical piece, is our custom matching algorithms. So what that means is that we don't just throw any nurse, throw as much talent as possible and see what happens. It's really important that we custom match for both sides. So let's say you are a recruiter at Johns Hopkins or at Stanford and you log in, like you don't want to see 100 nurses, like you want to see 11 that are the exact right fit for you at the time. Same thing for a nurse. Let's say you're a highly sought after ICU nurse or OR nurse, like you don't want to hear from 100 employers. You want to hear from 4 or 5 that are the right fit for you, that match your preferences. And so that's what our custom matching algorithms enable. And so the end result of all of that is hiring that happens in 20 days or less, as opposed to the 80-day national average. And just faster hiring for both sides of the platform, as well as significant cost savings too.
Yeah, and part of that faster hiring ends up reducing the cost that they would have, right? Because now they're not spending all this additional maybe marketing dollars trying to get in front of people. And like you said, even when that happens, they either end up getting no applicants or they get way too many applicants that aren't qualified that they have to sift through, and that's a time waste.
Yeah, absolutely. And the biggest cost savings is actually on contract workers, right? So every executive we speak with is trying to reduce the number of contract workers, what we call travel nurses, in their facility. And so, because it's expensive. It's too expensive. Most hospitals cannot afford that. So it does help them reduce that cost too.
Yeah, and sometimes there's obviously instances where the travel nurses make a ton of sense for certain facilities. But when I used to talk with people, it was kind of always named like a Band-Aid, right? It wasn't like always the full solution. And everyone was always interested in like to the temp to perm well, on the administrative side, you obviously had some professionals that didn't mind the travel nursing and new assignments every couple of weeks, but interesting approach.
Yeah. So that's why we focus just on permanent.
That makes sense. So as far as I guess I'm guessing one of the other things that your customers end up getting, and this is probably incorporated in the algorithm, is the data that you have too, right? The understanding of, and does that even go beyond the algorithm, just as far as like maybe ahead of hiring? Yeah,
absolutely. To answer your question, I'd love to chat a little bit more about what's happening on the employer side and on the talent side. So on the employer side, the Incredible Health Marketplace is a workflow product. Like you get a lot of talent. You can automatically schedule your interviews. You're able to do in-app chat and so on. But one of the things that our clients love, or that the employers love, is our data analytics. So when you're operating a marketplace, like you have access to a ton of data, like nationally, right? And so the employers are able to see not just their own speed, like how many candidates are spending, how many days are candidates spending in each step of the hiring process, or how many candidates are dropping off from one step to the next, but they can even benchmark it anonymously, of course, with their competitors, locally and nationally. And that really helps that in-house hiring team identify bottlenecks, identify areas of improvement, as well as just celebrate successes. I mean, there's some teams that are phenomenal at hiring. And so that's really helpful. Now, on the talent side, what we're doing there is a little different in that, like, we're not just the place where a nurse finds his or her job. We need to be the place where they manage their career. And so we offer a whole range of free services and tools to nurses. So for example, we offer free continuing education to every single nurse in the country, which they need to renew and activate their licenses. It's a compliance thing. And they usually have to pay for it out of pocket, but in Incredible Health's apps, they get to do it completely for free. We have free salary estimators. We have a mental health product, and we continue to add free features and services that help nurses even between jobs. Even if they're not using the core hiring marketplace, they can take advantage of these other services to continue advancing their career.
Which is really needed, right? When you're dealing in a two-sided marketplace, making both sides happy. So I love the approach. I'd love to shift focus a little bit, and I guess it still has to do with both the talent and the organizations that you end up working with. Let's talk a little bit about the nursing shortage. You already kind of talked more about the resources that you provide to providers, but I want to talk more. I guess this affects everyone, right? This affects both sides of the equation. Let's talk a little bit more about that, and I guess how you're helping you're never going to stop the shortage, but we can counteract it in some ways, right?
Yeah, absolutely. So healthcare is the biggest labor sector in the country by number of workers. bigger than government, bigger than tech, bigger than business. Like, it is like the most, 1 in 8 Americans is working in healthcare. And it's also the most amount of dollars spent on the labor too in the country. Now, what's been happening, and this is a trend that started long before the pandemic, is our demand for healthcare as a country keeps going up, right? Our population is aging. Of course, like pandemics add more demand to the system as well. But our supply of workers, of healthcare workers, has not kept up with that demand. And this is a trend that is going to continue even after the pandemic, right? And so that's just made things really challenging, whether you're on either side of the marketplace. And we are on track to be 1 million nurses short by 2024. We are literally missing 1 million nurses in the country that we desperately need. And so that is one of the biggest issues that's going on in this market that's causing the challenges. Now, there's a second issue. So we talked about the supply shortage. There's also an inefficiency problem. I would say a lot of what Incredible Health does today is tackle the inefficiency issue, in that the right talent isn't showing up in front of the right employers fast enough. But we do have plans to counteract that supply shortage as well. Offering continuing education is our first step into that, but there's more coming in the future to solve that underlying supply shortage too.
Yeah, it's one of my favorite terms when you're talking about this, right? Counteract, because that's really what you have to do. It's not like there's been people that'll put in either chat rooms or on like different forums, right? Like, well, let's just let more people become nurses, or let's let people become doctors, and that ends up creating sometimes also a lack of standards and a lack of the best people practicing, right? If you just let everyone through the door, and also can affect rates.
Absolutely. So let's talk specifically about the bottlenecks that are driving this shortage, right? So there's a few of them. So there's one huge bottleneck before nursing school or medical school. I mean, pick any clinical profession, right? There are huge wait lists, like tens of thousands of nurses per school, tens of thousands of candidates per school who are trying to get in, but the nursing school does not have enough capacity, right? They don't have enough faculty to train those nurses. So there's a huge bottleneck. Just that, there's a lot of people who want to become nurses and doctors and so on, but there's not enough, facilities and so on to train. Now, another bottleneck is happening right after school. So let's say you finish as a nurse, a doctor, so on. There are not enough training programs that across the country that train a nurse to become a more specialized nurse. And so that's a huge bottleneck. Another massive bottleneck that's happening is retirement, right? So 25% of the nurse workforce is going to retire in the next 5 years. I mean, this is a relatively older workforce on average. So that's going to create another, issue in terms of the shortage. So it's going to take multiple parties, whether it's government, employers, technology companies like ours and so on, to really address all of these different bottlenecks. And it's going to be multiple set of solutions to address them all.
And there's some quicker fixes in there than others, right? Because now you're talking about whenever the government's involved, there's legislation that needs to end up changing. That can be a multi-year process. So what's really cool about what Incredible Health's doing, right, is you're taking the technology approach of innovating in the space and trying to make your space as efficient as possible. And then obviously the next layer would be the legislation that ends up changing and some other factors, right, that also speed the process up. So really interesting.
Yep.
I want to quickly shift focus before we wrap up here. We want to talk a little bit about your new retention hiring suite. Can you talk a little bit about that? And then I guess any other product updates or things that are coming up on the horizon?
Yeah, sure. I mean, later this month, I guess, we're now, this is September, we're talking about September, October, 2021, right? We are announcing our retention hiring suite. So just to talk about the problem for a moment, one of the big issues that hospitals and health systems are dealing with today is retention, nurse retention. And we've seen the turnover of workers increase during the pandemic. It was about 18.5% annual turnover on average prior to the pandemic. It's gone up to 21.5%. And a lot of that has to do with, just nurses are getting overworked. There's a lot of burnout that's happening, a lot of mental health issues and so on. So, what we're launching is a suite of tools and features that enables hospitals and health systems to retain their talent, or, put another way, it helps nurses stay in their jobs. And an example of that is, they're able to, when a nurse is going through our marketplace, they are able to consider multiple opportunities, and they're able to do a very thorough job search, because the evidence is showing that when they do that and they go through a thorough process and select an opportunity, they are more likely to stay. Our retention numbers compared to other sources is 15% higher than the baseline. So when hospitals and health systems are using Incredible Health, the nurses that they're hiring from us, they're 15% more likely to be retained. And so we're adding, that's an example of some of the features that we're adding to continue enhancing the retention of the nurses too.
Yeah, it's a lot of people too don't think that through fully, right? When you look at it's just like it is cheaper to keep a current customer than to get a new one. It's more affordable. It's better for morale usually to retain your current workforce rather than just keep the revolving cycle going of hiring new people, which is not easy, right? Exactly. So that's really interesting new feature. Well, hopefully, by the way, this is not the last time you come on, and other members of your team. We'd love to have you on again real soon, but really appreciate your time here today and wish you and the Incredible Health team all the best.
Thank you so much for your time, Jared. Thank you for having me.